Good afternoon, everybody. Today, I want to talk about appendicitis or appendix, as most people call it. Now, what is the appendix? The appendix is an organ that is located in the large intestine. It is like a finger like projection that is under the cecum, while the cecum is the largest part of the large intestine. So, it's like a finger like projection or continuation of the cecum. So, it's part of the large intestine. That means everybody has an appendix, except in people that have had a surgical removal in a procedure we call appendicectomy or appendectomy. Now, what exactly causes problem with the appendix? The appendix, like I said, is a finger-like projection of the cecum, and there's a communication between the cecum and the appendix. So this communication line, sometimes substances from the cecum, that is from the large intestine, enter into the appendix and come back out in the cecum and continue to move with the rest of the intestinal contents. However, in some cases where those things enter into the appendix and they do not come back out again, they lead to an inflammatory reaction which causes what we call appendicitis that we now need to manage. Now, the appendicitis as a condition is not common in extremes of age. That is, it's not common in young people. People under 12 years old rarely have appendicitis because the space between the appendix and the cecum is wide. Anything that enters into this appendix usually come out. People that are also older, above 50, 60, do not usually have appendix also because in them, whatever enters in this, the communication between the cecum and the appendix is narrow because the appendix has shrunken as a result of age. So in them, it's not likely for anything to enter into the appendix. Now, in those people between the age of 12 and let's say 50 or 60, those are the people that are at risk of appendix because substances can enter into the appendix and sometimes those things will not come out. Things like stones that are eaten in food, some seeds that are swallowed when you are eating some fruits, worms and can also crawl into the appendix and not come out. And they are what we call feculates, that is like particles of feces that have been dried sometimes can enter into the appendix and not come out. When these things enter into the appendix, they cause what we call an inflammatory reaction, which is a reaction, a reaction that the body, any part of the body mounts to invasion by any organism or by any parasite. So, with the inflammatory reaction, there is what we call redness, there's pain, and there is a production of inflammatory fluids like serous fluid, and sometimes you may have pus if it continues for a long period. That's what causes, that's that by in a nutshell what appendicitis is. Now, if it is neglected, the collection around the appendix will burst, and those things that are inside it will escape into the abdominal cavity and cause what we call generalized peritonitis. Now, what are the things that anybody that has appendix or appendicitis, what are the symptoms that the person will feel? The first symptom I feel is pain. The pain is abdominal pain, usually initially located around the umbilicus, that is the navel, and that pain after some time migrates down to the position I was describing initially, the right iliac fossa. That's the lowermost part of the uh, right part of the abdomen, somewhere around this place. You can follow me, somewhere around here. So usually, most of the time, that's what usually happens. The person has pain around that point. It may start around the navel, then move down back down to the right lower part of the abdomen. So when this happens, the person may also be nauseous. That is, the person feels like vomiting a lot, or the person may be vomiting, and then so the person will don't normally have what we call anorexia. The person will not have appetite to eat. When you notice all these symptoms in combination, find the doctor closest to you. So the doctor will now do some tests and examinations and then prescribe the right management. It can be managed medically initially if it is not really bad. We can give broad spectrum antibiotics intravenous most of the time. And if this is done, sometimes the symptoms will go down, the person will feel better. But if appendicitis has been diagnosed, the person is supposed to have a surgical removal as soon as possible. There's something we call interval appendicectomy. That is 6 weeks after medical management, the person should come back for removal of the appendix. Most of our patients in this environment, the moment you give them the treatment and they feel better, they run away from the hospital. They don't come back for the surgery because of an aversion for surgery and sometimes because of the cost implication. Now, here we should know that if this is not done and is neglected, repeated episodes of appendicitis can actually lead to rupture of the appendix, which will cause generalized peritonitis. And instead of appendicectomy, the person will now be having what we call an exploratory laparotomy, which is usually more than double the cost of removing the appendix on its own. I hope we've learned one or two things about this topic on appendicitis and its management today. Thank you for listening once again. Have a lovely day.